PCOS, how do you know you have it? Who's got it? It's such a debate, one that I went through. I don't want you to go through it. Here are some unexpected signs and symptoms of PCOS to keep in mind. Sign number one is simply having a lot of issues with weight gain. You're gaining weight, you're hitting it at the gym, you're doing everything you're supposed to do, and the weight's not budging. You may have insulin resistance that's associated with it. That's when that insulin level is super high and blocks us from losing weight. Sign number two, what would I say is the most common? I'd say estrogen dominance. That's when these breast boobs, I don't know if I'm allowed to say that, but they hurt, they're painful. And this is not just a little bit of I'm uncomfortable. This is like, oh my God, this hurts. So if your boobs are hurting mid-cycle, that's a sign of PCOS, because you could have estrogen dominance where your body's just holding on to it and you can't get rid of it. Sign number three, migraines. If you're getting a lot of migraines and it's cyclical throughout the month, that's a sign you could have PCOS. It's also connected to high estrogen and low progesterone. Did you know your gut is connected to PCOS? So if you're having a lot of diarrhea or constipation right around your period time, then that's a sign that you could have it as well. PCOS really is an autoimmune disease and is associated with inflammation. So joint pain that you can't really explain, that's new, could be a sign of PCOS as well. And connecting that to another inflammatory process, neuroinflammation, inflammation up here in our brains, is real. Anxiety and depression and even OCD, all inflammatory brain conditions, can be unexpected signs of PCOS. Acne, hair loss, some of those more people are comfortable with and understand. And of course, having trouble getting pregnant can be a part of it too. And what a lot of my patients tell me is that they think PCOS is just an issue of their 20s. That couldn't be farther from the truth either. It's actually all throughout our life as women. A lot of this I've just told you I've been through, and it was my struggle to get answers to that list of symptoms that led me into the field of integrated and holistic medicine. I hope this helps you, but don't assume PCOS is just limited to right down here. There's so many other whole body systems that are affected by this diagnosis. All right, if you want to learn more about PCOS, then don't forget to like and subscribe.